Hi, I'm Dr. Sita with Insight Functional Health. And in this series, we're going to talk about a number of different aspects that are the foundations of functional medicine or good health. And in this video, we're going to talk about leaky gut. And what I mean by that is really how the gut is, or how the barrier function of the GI tract is working. When you think about the GI tract, there are lining cells, these light pink cells that should be very tightly adhered to each other. And as long as they are, then anything that's floating around up here should not be able to get across that barrier into the bloodstream. And so, in order to come across, something has to actually bind to a receptor and get pulled in to get into the body. But what happens very frequently with our patients is that any number of things can disrupt this barrier. And that can be inflammation, it can be stress, emotional stress, but also from chronic infections or from foods, from an imbalance in the bacterial populations in the GI tract. And then this barrier breaks down, and now the junctions are sort of like the mortar between the bricks is no longer tight. And you can have chemicals that are getting from the GI tract across the membrane into the bloodstream that never should have been there in the first place. Once they get across, then they circulate in the body and they can go anywhere. So if you have a half digested cashew protein or dairy protein or whatever it is that gets across this barrier and now circulates, it can be driving things like migraines and skin reactions and headaches and fatigue. And we typically don't think of a headache as a problem with the gut. And we typically would go to a dermatologist for a skin problem, but very frequently there are clues in the GI tract that need to be addressed before we're really going to optimize overall health. So when I work with patients, my goal is to optimize this barrier function. And there are a lot of other ways to think about this. When you think of the surface area of that barrier, in your intestines, you have the small intestines, and they're all folded up on each other. And then they have villi and microvilli, which are little, almost hair-like projections that allow you to have a lot of surface area so you can absorb your nutrients. And if you were to spread that surface area out, it's about the size of a tennis court. And just compare the surface area of a tennis court to, say, the surface area of my skin. We think of the skin as a barrier protecting the body, but the barrier in the GI tract is actually huge, and your immune system is lined up appropriately in response to that. And so there's about 70% of your immune system that's lined up a lot, just underneath the GI tract, to be able to assess what's going on there. Do they need to have more inflammatory response? Is there access to pathogens, and can the immune system be ready to deal with them? So if there is any sort of an imbalance in the GI tract, whether it's foods you're sensitive to that are causing inflammation, or it's an imbalance in the bacterial populations or pathogens, all of those things have a huge impact on the immune system. And since your white blood cells circulate all throughout the body and they create chemical messengers that are called cytokines that also circulate everywhere, you can have symptoms of that inflammation that result all over your body, even when it's coming from the gut. So when I try to work with people, my goal is to try to get control of inflammation any place that it is encountered, and frequently that starts in the gut, and to make sure those barriers are working and that your immune system is not being overly stimulated. We also think about the bacterial populations in the GI tract. And your gut should have a huge diverse array of bacteria. And I think of it kind of like its own ecosystem. But in an ecosystem, you have a lot of different organisms that interact with each other, and they produce different waste products that other organisms use to thrive on. And so if you think of the bacteria in your gut almost like its own organ, and it's producing metabolites, and some of those metabolites are getting absorbed into your body, they can have a profound impact on the rest of your system. And this is being recognized more and more, but we understand there's a gut-lung axis, a gut-brain axis, there's a gut-skin axis, there's interactions with hormones and heart disease. And so when I work with patients, my goal is to optimize these as much as possible so that we can set the stage for good health. And if this was helpful, we have a lot more content online on our website and also on YouTube. If you're a patient and you're in the DC metro area, DC, Maryland, and Virginia, and you'd like to talk to me, you're welcome to reach out through our website. You can schedule a discovery call at any point. I see patients in Maryland and also telemedicine from wherever I'm licensed. It's so great to see you. Have a great day. Thanks. Bye-bye.